of the Conference Planning CE team for HSLI. I'm Peggy Carey, pronouns she, her. Our first session, which is being recorded, is a sneak preview of the newly expanded 2-hour version of Health Statistics on the Web, presented by Erica Lake, MLS, a distinguished member of the Academy of Health Information Professionals, who is the Medical and Academic Library Outreach Coordinator for Region 6 of the Network of the National Library of Medicine. Erica joined the region in September 2021. In addition to engaging health sciences librarians, hospital librarians, and SLIS programs and students, she is the DocLine coordinator for Region 6 and the editor of the monthly Health Highlights newsletter. Erica works remotely from Duluth, Minnesota, and has more than 20 years of experience in the field as a hospital librarian, an academic librarian, and a research and evaluation specialist, as well as numerous publications and presentations. Health Statistics on the Web, now being offered for the first time to us, is one of 5 online classes she teaches and is eligible for MLA-CE. So please complete the evaluation at the end of the session in order to claim the CE, and we're grateful to NNLM Region 6 for this. There will be a break during the class, and we ask that you please post your questions in the chat throughout the session, which I'll be monitoring. And please note, again, this session will be recorded and will be made available to all who have registered for the conference. Now I'll turn this over to Erica.
Thanks, Peggy. Let me just see, I've got a little bit of maneuvering here to do to get the slides to show. Can you hear me okay?
Yes.
Yep. Great. Okay. And are the slides showing?
Yes, they are.
Terrific. Okay. We're 2 for 2 right now. I'm hearing a little bit of feedback. I'm not sure if people are muted or not. Maybe on my end on my headphones. Is there feedback for everybody else, or does that sound all right? Okay, great. I think that's all set now. Well, I'm really happy to be a part of. Sorry, I'm hearing so much feedback. I'm not sure what I need to do on my headset here.
That seems a little better.
Sounds like everybody's getting a little feedback. That sounds better. Yes, I agree. Great. I don't know what happened, but I think that was it. All right. I'm really happy to be a part of your annual conference. Thank you for inviting me. I would have loved to meet all of you in person, and especially I've seen Starved Rock State Park. I didn't know about that before, but hey, there's always next year, right? We'll try it then. Let's see. We just have a couple of housekeeping items to cover before we get started. I would like to ask that everyone please stay muted for the first part of the presentation. As Peggy mentioned, feel free to enter your questions and comments in the chat at any time throughout the session. Peggy's going to help me keep an eye on that, and we'll queue up any questions that come in during that time to answer during our several question breaks that we have set up. We do have closed caption available, and I believe in Teams you can get to that by clicking on the icon with the 3 dots and selecting turn on live captions there from the list. We've got that one break scheduled. It's roughly halfway through. I had originally intended for that to be about 10 minutes, but I think we'll need to cut that down to 5. We can talk about it when we get to that point and see what everybody's preference is. If you do need to take a quick little break during the class, please feel free to do so. Also, this is eligible for 2 Medical Library Association continuing education credits, and you'll be able to claim that through the evaluation link that we share with you at the end of class. And as Peggy said, that evaluation is really important to us because we use your feedback to improve all of our future training. So please take a moment to complete that for us. Before we get into our class content, I just want to share a few words about who we are. So you're probably familiar with these acronyms, but maybe unsure how we all relate to one another. NLM, the National Library of Medicine, is one of the 27 institutes of the offices of the National Institutes of Health. It's the world's largest biomedical library and produces online resources we all know and love, like PubMed and Medline Plus. NNLM, the network of the National Library of Medicine, is the outreach arm of NLM, and we work to ensure health professionals and the public have equal access to health information. NNLM is made up of 7 regional medical libraries, 4 national centers, and 4 national offices, all providing training, funding, and engagement opportunities to over 9,000 NNLM member organizations. If you'd like to learn more about us, you can check out the NNLM website at nnlm.gov. All right, we have 3 objectives for the class today, and they are to recognize the differences between data, data sets, and statistics, understand a 4-step process used to locate relevant health statistics for a particular circumstance or issue, and identify online resources that provide health statistics at the local, state, national, and international level. We won't be doing any math today or talking about how to calculate statistics. Instead, we're going to be focused on how to locate and select health statistics that are available through free, high-quality resources. Some class materials have been shared with you in the conference packet, so I hope you have those all available. We have the PowerPoint presentation slides. There's a link to a handy-dandy online table you can use for reference in the future. It lists all the resources that we're covering today and indicates the types of data that's available in each one. One correction there, we do not have our international resource on that online table yet, but I can let you all have an update when we do have that added. And then the last material that we have for you is the guided handout that you can use during the class. Has a few questions on it that we'll address during the presentation. There's a place for you to make notes on each of the resources that we explore, and then there's a space to work on the in-class exercise that we have. So the agenda for the next 2 hours or so begins with a very brief overview of data and statistics and their uses. Next, we'll talk about the steps to finding relevant health statistics and begin working on the guided handout exercise. And we'll spend the majority of our remaining time exploring several resources. And you can just watch the live demos, or you can follow along on your own device and get some hands-on experience. Then to wrap up the class, we'll return to do part 2 of the guided handout exercise, and we'll address any remaining questions. All right, so I am just going to turn off my camera now, and we're going to move into our class content now.
Okay, beautiful. So we had to schedule it? It's the only way. All right, sounds good.
I think we just need one person to mute themselves, please. All right. A good way to start talking about data and statistics is to define what they are and what they are not. Data are the raw numbers or individual counts of something that haven't been processed, cleaned, or organized in any way. A data set is a collection of data maintained in an organized form according to particular criteria, and statistics are data that's been analyzed or summarized in a way that makes it actionable, and it helps us to answer questions like how much and how many. Much of the health information that we see reported is in the statistic form, and it can be presented in a variety of ways, such as a percentage, a graph, table, figure, or a map. So a textbook definition of statistics is a numerical summary of measures computed on samples. Health statistics are a numerical summary of data that characterizes the health of a population and the influences that affect its health. That population could be an entire country or a region or a city. Parameters are different values that describe characteristic of that population, such as birth rate or disease prevalence. Because you can almost never measure an entire population, we take representative samples and analyze them to estimate those parameters. Samples are often collected over a specified period, and they're large enough so that we can conduct adequate analysis. And while there are many important uses of health statistics, which we're going to touch on in the next slide, it's really important to remember that statistics are collected to meet the needs of the collector. This means that they can be influenced by the collector's perspective or bias, and that could affect what data is gathered to begin with and what outcomes are reported. So always look for notes that describe the reasons for and methods of data collection, and be sure to review them carefully. It's also good to remember that information on a topic might be collected in different ways in different surveys, and estimates of the same statistic might vary between those surveys. For example, there are many surveys that measure cigarette use, and while each provides statistics on the same topic, the estimates of cigarette use differ between them because they use different methodologies, sampling frames, questionnaires, and definitions. So health statistics are a form of evidence, and they can be used in many different ways. They can provide information about the health of a population and what influences it. And while statistics are population-based, they can help individuals understand where they fit within the larger context of their community. And they can help identify health disparities that exist between different community subgroups. Statistics can be used to track and monitor trends in health status and healthcare delivery, as we've certainly seen during the pandemic. Statistics can also be used to guide research, policy, and program development. They help us identify needs, shape how resources are allocated, and enable us to evaluate effectiveness and impact. So we're going to talk broadly about how to find health statistics using a 4-step process. The first step is to formulate a question. And you may want to consider the age range, geography, and time frame that you need the statistic for. So one example of your question might be, what percentage of those 18 and over reported having coronary heart disease in Vermont in 2019? Another example might be, how has the rural-urban distribution of the geriatric patient population in the United States changed in the last decade? The second step is to choose the best resource to answer your question by thinking about who might collect the data to produce or publish the statistic that you're interested in. You can consider federal agencies, state and local organizations, or institutions that are tied to the subject of your search. And that online table that we included in your class materials can help with this step. After you've decided which resource to use and you performed a search, the third step is to evaluate what you found and consider if it's appropriate and sufficient to answer your question. The fourth step is to repeat as needed, either for additional information or for a different question. All right, time to break out your guided handout if you don't already have it out. And we're going to focus on just step 1 of our 4-step process. So I'd like you to take just a couple minutes and formulate a question for a health statistic that you're interested in finding today. And depending on that statistic you're trying to find, you may want to include age range, geography, or time frame in your question. And the 2 examples that I just shared with you a moment ago are on that guided handout for your reference. There's also room on the handout to write down your question. And we're just going to take 2 minutes to do this. So until 1:11, we'll take a break and work on those. And I do have the chat open, so if you have any questions, either write that there or you can unmute yourself and ask a question too. Again, we'll join back in about 1:11. I am showing 1:11. Was that enough time for everyone? Feel free to unmute yourself and chime in. Is everyone able to form a question? Great. Right. Thumbs up icon. Oh, we don't have that available in Teams? Oh no. Okay. Great. I'm seeing that a lot of you have been able to formulate a question. If not, you can be thinking about that while we're moving through the class. Right now, we're going to start looking at those key resources. And again, you can choose to either just watch the demos or you can follow along on your own device. And as we explore these resources, feel free to make some notes on your handout about which ones might help you answer the statistical question you've just formulated. And we're going to begin with 2 portals. And our first portal is the National Center for Health Statistics, or NCHS. So the NCHS is the nation's principal health statistic agency, and it's been a part of the Centers for Disease Control and Prevention since 1987. They compile statistics from the different data they collect to help guide decisions on things such as policy initiatives, the healthcare system, and health disparities. Because they're a federal agency, the NCHS is required to adhere to certain quality guidelines to ensure the integrity of the information they provide to the public. And these include using the best available science and statistical methods, being transparent about the data and the methods that they use, and ensuring information is presented in a way that's comprehensive, informative, and understandable. So I am going to click on this hyperlink down here in the bottom center of the slide to open up the website now. And you can do this too if you'd like, or you can plug the URL into your browser. We're going to open this up, and I know that I'm going to have to do a little maneuvering between my screens to bring this over. Can everybody see that website okay? Is it large enough? All right, so you could simply start looking for a particular statistic by typing in some keywords up here in the search box in the upper right-hand corner. But I'd like to highlight some different features of this resource. So we're going to pull up statistics as we navigate around the site. And right here, you see a section for the latest COVID-19 data. Underneath that is an area where they highlight new data files, resources, and reports that are available. Scrolling down, you'll find several tabs going horizontally across the screen that allow you to quickly navigate to different content. On the left, there's a What's New section. To the right of that is the always interesting stat of the day. And below, there are links to content grouped for different users. Notice they have librarians on there. So NCHS conducts a number of different surveys to acquire data, and you'll find these by scrolling back up to those tabs we just looked at, clicking on the Data Collection System tab on the far left, and then on Population Surveys underneath. And here we see the list of their surveys with the title, the data source and methods used that tells us where the data came from or how it was acquired. And then there's a select list of data items here, which gives you an idea of the type of information that you'd find in each survey. And some of the survey information is extremely timely. Underneath vital records here in the middle, we have Vital Statistics Rapid Release. And this is a program that uses provisional data to estimate important statistics for public health surveillance much faster than would be possible using final annual data. And of course, having this information sooner allows us to act on it sooner. And this has been incredibly important during the pandemic as we've been concerned about what kind of impact it's having on things like mental health, childhood vaccinations, and cancer treatment. And last spring and over the summer, the data from one of their surveillance activities down here, the provisional drug overdose death counts, received a lot of attention because the data showed a 30% increase in the number of people who died from drug overdoses in the US over the previous year. And I'm going to open up this first link here for the monthly national and state level drug overdose death counts. And they've got two ways to view trends here for the last 12-month period. You see this graph here. Below that is a map with all the states. And you can hover over each state and you'll see a pop-up box to the right that will show you how the deaths have changed in a 1-year period. Very few states are blue, which has had a decrease. Here we see the national percent changes is up 9.7%. Below the map, we have a technical notes area, and this is where you'll find the details on the data and how these statistics were compiled. And NCHS has another way to track national data trends, and that's with their new Health United States website. And this information has actually been reported in different ways for the last 44 years. But with this latest redesign, the Health United States program is making it even easier for users to access key findings, featured charts, and trend analysis for 23 different health topics. And the health topics fall into 4 main areas: health status and determinants of health, healthcare utilization, healthcare resources, and health expenditures and payers. So in addition to websites like that, the NCHS disseminates their information that they create through reports and other publications. I'm going to show you one of their publications here. It's their excellent data briefs, and you'll find these under the publications tab on that far left-hand side. And these are short reports sharing statistics from those surveys that we just looked at. And you can search by survey to pull up information by keyword, by author, and then you'll see all the data briefs listed here. This one that's at the top of the list was just put in here this morning, I think. And it looks like they've added a visual abstract, so I am going to bring this one up to show you. Oh, shoot, they don't have the visual abstract yet. Never mind that. I'm going to show you another one because the visual abstracts are neat. So I'm going to go down here to one that was published last month. This is Organized Sports Participation Among Children in the US. And every data brief will have a key findings area. And that's where they share their most important statistics on the topic. You can print off this data brief as a PDF, and then those visual abstracts, you can utilize those in social media posts or in presentations, and they're a really engaging way to share the key statistical information. So though we're focused on statistics rather than data in this class, I will quickly point out when a resource makes data sets publicly available. And NCHS does. You can find it under the Data and Tools tab. And on the left, under Data Access, you'll find information on how to download and use their data. Also under this tab, on the far right, under Data Visualizations, you'll find Stats of the State. I'm going to pull that up. And those of you following along on your own device, you can just click on any state you'd like. I'll click on Illinois. And here you'll find statistics on key health indicators, as well as birth and death information. And then you can click on any of these hyperlinks that are here. And this will take you to a national map that visualizes how your state fits in overall. The lighter colored states are going to have lower rates of teen birth in this instance. The darker colored states are going to have higher rates. You can hover on each state and see what that rate is there. So there's just a wealth of information on this site. I encourage you to come in here and spend some time exploring it after this class. Before we're leaving, though, I do just want to point out their email updates that are down here. They have an extensive list of topics that you can subscribe to, and it's an easy way to stay up to date as new information is compiled and shared in areas that are of interest to you. But for right now, we're going to move on to our second portal, and that is Medline Plus. Medline Plus is the National Library of Medicine's consumer health portal, providing information on diseases and conditions, wellness issues, drugs and supplements, and medical tests from select organizations. And you can also use the health topic pages on Medline Plus to quickly access statistics on a particular topic. And that's what we're going to focus on when we bring up this page. Again, I've got to maneuver a little bit and bring this over for you. So in the top left-hand corner, you'll see two different ways to get to those health topics. You can click on either of those. And this brings up the alphabetical listing where you can locate a health topic that way, or you can look under one of the categories that are down below. And I'm interested in some information on cancer. I'm going to click on that. And this takes us to a list of all the cancer-related health topic pages that are available. And I'm going to scroll down just a little bit and click on breast cancer. Here's our health topic page. These boxes at the top here serve as our table of contents to the page. And you'll see that under research, we have a link to statistics and research. And here are several different sources for statistics. In parentheses to the right of the hyperlink is the organization that's providing the information. Here we see some from the CDC. Here are some other statistics from the National Cancer Institute. And I can click on that hyperlink and that will take me away from Medline Plus and straight to the statistic of interest for me on the National Cancer Institute page. So just as when you might use Medline Plus as a starting point when you're unfamiliar with a particular disease or condition, it can also be a really great starting point when you're not sure who might produce statistics on a particular topic. Okay, we are going to move away from portals now to focus on two resources where you can find national statistics. And both of these also happen to provide statistics at the state level, so you can directly compare national and state information on both of these resources. And our first one is the Behavioral Risk Factor Surveillance System, which is also called BRFIS. It's sponsored by the CDC and other federal agencies. First conducted in 1984, it's now the world's largest continually conducted survey system. BRFIS collects data from adults 18 years and older about health risk behaviors, chronic conditions, and use of preventive services. And then they use that data that they obtain to plan health promotion activities. And though it's sponsored at the national level, the surveys are conducted at the state level, with all 50 states, the District of Columbia, and US territories overseeing thousands of interviews every year. The data used to be collected just through landline phone surveys. I know I remember those, but as technology and culture has changed, they now utilize cell phone, mail, and internet surveys. All right, let's bring up this home page. There we go. So Burfus uses several different questionnaires for their surveys, and all of them consist of a set of core questions, but they may also have optional modules and state-added questions. So before diving in to search for a specific statistic, it can sometimes be helpful to first scan the Burfus questionnaires. So we're going to do that. We're going to bring up this, click on this middle box, and this takes us to a screen where it shows us a number of different ways to browse those questionnaires. You could go by year, and here we have them going all the way back to 1984. I'm just going to open up the questions that were asked last year, and it's as easy as going to the 1 or 2 pages of the table of contents. There are those core questions that were asked, and then the optional modules that were asked last year. We can also bring these up by states. I'm going to, again, just click on last year. And here we have the states in the far left-hand corner, and you can see how the optional modules compare. They're quite different in each state about what's being asked. Arizona asked about diabetes, Colorado asked about cognitive decline and sexual orientation and gender identity. Might give you some clues as to what's important in that state at that time. So then if you're ready to start finding a specific statistic, go back to the home page here. You click on prevalence data and data analysis tools, and then on prevalence and trends data right underneath the graphic. And here I see that I have 2 options for how to locate a statistic. I can either search by location or by topic. And the process and the results are really similar in both of those choices. So we're just going to use topic for our demo today. And let's have some audience participation for this one. I'm going to pull up this topic list here. And why doesn't somebody put into the chat what they'd like us to take a look at? And I'll just take the first one that I see. Physical activity. Okay, bring that up. Let's see if there's another choice here. Okay, it's very specific. We can look at aerobic activity, strength activity, exercise, physical activity. Any preference there for Elizabeth, who suggested physical activity? Exercise. All right, choose that, and then we'll hit go. Okay, it's working, it's working. So here we see national results for this question. Here's our question. During the past month, did you participate in any physical activities? And you could respond yes. We're showing states that responded yes. Those with the lighter colors are those that had a lower number of people responding yes, and the darker colors had higher numbers of people responding yes. We have the option to view the overall results, or we could look at these by different demographic variables like gender, age, race, and ethnicity. And Burfus has recently begun providing local area estimates for select metropolitan and micropolitan areas too. And you may have the ability to view information at that level. This one does allow us to do that. You'll see this here. So we could just click that box, and then it's going to still show the national map, but it's going to add in those metropolitan and micropolitan areas. And again, you could just hover over any of those, and you'd see here for Portland and Maine, we've got information Click on North Dakota and see it that way. And we can change this from a map view to a bar or a table view and just see the percentages and sample sizes presented in a different way. And you can print off those different tables too. And then down below, whoop, we have a notes section, and this is where you'll find out information about the data source and measure definitions that were used. Okay, I apologize for scrolling fast up that. I do just want to point out before we leave this site that Burfis does make data available, and you can get to that by clicking on survey data and documentation. And this is where you'd be able to find information on how to obtain their data. And they also have some pretty great guides about getting some help conducting your own statistical analysis. We're going to move on to our second national resource now, and this is State Health Facts. And this is produced by the Kaiser Family Foundation, which is a nonprofit organization focused on major healthcare issues in the United States. The organization refers to themselves as KFF, and that's what you'll see on the website when we open it up in a minute. And you'll find statistics on more than 800 health indicators. They add new ones every year. There's lots of information related to health insurance and healthcare. And the data comes from a variety of sources, including KFF reports, public websites, government surveys, and private organizations. I'm going to click on the link for State Health Facts now. Move it over. And this is a resource that's been redesigned since March when I last taught this class. You used to see a map of the country here, and now you've got the search box so that you can immediately start searching by keywords. Underneath that, you have the option to click on one of the topic boxes and start browsing. So I'm going to bring up some information that way. I'm going to browse for COVID-19 statistics. And we have a lot of COVID-19 indicators here. Let's look at COVID-19 disparities for death by race and ethnicity. We'll click on that link. And here we have a table that shows the percentage of deaths broken down by race and ethnicity, as well as what percentage of the population each race and ethnicity is in that state. And I can change this from a table view to a map view. And right now we're looking at the white percentage of deaths across the country. You can hover over each state to find that rate. I could change this to look at different views. And then if I scroll down below underneath the map, we can see the note section. And this is where you find out where the data came from. And we see that these stats were from an analysis the KFF did on provisional death count data from NCHS. Yeah. I'm going to go back to the home page now, and I'm going to show you a really cool interactive tool that they have on this site. And it's just down the page a bit on the left-hand side. It's their custom state reports. And this is a really straightforward, easy way to compile statistics of interest for a single state or multiple states, and you can create your own report to share with others. So for this one, I'm going to look at some alcohol-related numbers for the Midwest. So I'm going to click on mental health and substance use, and then I'm going to scroll down here to alcohol and drug dependence. And then I'm going to select individuals reporting alcohol dependence or abuse in the past year. So you'll see we've completed step one. We've selected our indicators, and it shows us step two over here is to select the states. So we'll click on that. I am going to choose the 7 states that make up Region 6. So we've got Illinois, Indiana, Iowa, Michigan, Minnesota, Ohio, and Wisconsin. Got our states indicated. Now we're going to hit 3, generate our report. So here we have the results have been broken down for us by teens and adults. And I'm going to just look at adult information now, so I'll close that up. And I see that Minnesota has the highest percentage of their population reporting alcohol dependence or abuse in the past year. And I want to know, what does 13.3% look like in terms of numbers of individuals affected? So I could go to refine data here, change the data view from percent to number, hit apply. And here we see that that means 572,000 adults. You also notice that even though some of these other states had lower percentages of their population affected, they have more individuals affected than Minnesota does. And I could go down here and modify my indicators or my states a little bit if I wanted to. I can download the data into an Excel spreadsheet so that I can further filter or manipulate the data. And I can share the customized report URL with others. All right, it is time for a question check. So I just wanted to see if there are any questions that have come up for you about those two portals or the two national resources that we've covered so far. Nothing so far. That's good. Okay. The two
Eric, we do
sample
have a question.
questions.
Yeah.
Now I have to remind myself what those two sample questions were. Remember, Jerry. Well, I you may be able to. I can think of some other resources that we're going to show in the second part of the class that might help you a little better on those. I'm pretty sure you could do the coronary heart disease in Vermont with the one we just looked at. That is also probably available on NCHS. Yeah, I think you have a number of different resources to explore for both of those questions. And again, the statistics might vary between them, even if they are stating that they are reporting the same thing. So it might be interesting to take a look at how they differ between the resources. Anything else that's come up? We can always answer questions for those resources later on in the class too. And I do have that break timed for right now, and we're not anywhere near halfway through the class. So maybe we do have a fairly large chunk of resources to cover next. If everybody is all right, we could either skip the break right now and wrap up a little bit earlier. I know that there is a break that's going to be happening for the conference programming right after this course. I'd like to be able to spend some time having a share out with the part 2 of our exercise. So that would allow us a little more time for that. Is there a general consensus?
How about anybody opposed? Speak up now.
That's a good way of saying it. All right, great. We'll just keep going then. Sounds good. All right, I'm gonna turn this back off and we are going to move into local statistics now. And these are resources that you can use to find information at the zip code or county level. We have 4 that we're going to look at. First one has a pretty familiar name. It's the US Census Bureau. So this is the federal government's largest statistical agency, and it's a part of the US Department of Commerce. The census is conducted every 10 years with a focus on population count. On their website, you'll find statistics on demographics and information on geographies at various levels, including state, county, city, town, zip code, census tract, congressional district, and tribal areas. You can find health statistics pertaining to disability and fertility, health insurance, and the business of healthcare. And the data on the site pulls from several other surveys in addition to the census. One of those is the American Community Survey, and that's conducted annually, and it has a bigger focus on community needs. We'll bring up the census homepage now. All right, this is another resource that got a snazzy new redesign just since last March. Here we've got the search box front and center, and right underneath that, they give you a hint of just how easy it is to start searching for information. And I have got a question in mind. I would like to know what percentage of people in Pittsburgh live below the poverty level. So I could just simply start typing in Pittsburgh. You'll see that this city profile pops up over here. And I could, excuse me, I could click on that and that would give me lots of different statistics for the city. But since my question is specifically related to poverty level, I'm just going to add that into the search box. And hit go. And here you see the quick answer to my question. In 2020, 19.7% of the population lived at the poverty level. You'll see that this search pulled up 231 tables, 231 maps, and 98 pages related to my search. And tables and maps are the main way the Census Bureau data is presented. The site contains over 5,000 tables, and they add new ones every week. And in addition to seeing data displayed in the map form, you can also build customized maps by selecting geographies and variables from different data tables. So I'm going to look at the results for this search. I'm going to click there. And this shows me that my two filters have been applied, poverty in Pittsburgh. That's also over here, geography, Pittsburgh, and poverty. And it actually pulled up lots of information here. You can see that they've broken it down by poverty status in the past 12 months, poverty status in the past 12 months for families, select characteristics of people at the poverty level, food stamp use, etc., going all the way down for 231 results. This one is highlighted, so we see that these are the results for that first result that we have there on the list. And in this column on the far left, you'll see that the information is broken into different subcategories. We can look at it by age, sex, race, educational attainment, employment, a whole bunch of things. Scrolling to the right, you can find the numbers and percentages that are there for each category. If I click on the notes icon up here, I can see the details about the data and the methodology that was used. I could also export this data to an Excel spreadsheet so that I can sort and filter it in other ways that I want to do. I'm going to go back to the main page now, and I'm going to show you the advanced search function. And we'll have some more audience participation here. Why doesn't somebody enter in the chat box a zip code for me? And I'll take the first one that we see. 60501. They're going fast. Okay, I'm going to write this down. 60501. And we're going to enter that here. There's find a filter and then search. Click on that. We've got a new search box up here. I'm going to put in 60501. And you'll see that we have the zip code. We also have something called the ZCTA. And this stands for Zip Code Tabulation Area. And these are the geographic entities that the Bureau designed to correspond with zip codes, because zip codes are really just postal service delivery routes, and they're not really geographic boundaries. The ZCTA is a little different than the postal zip code, but it's in the same general area. I'm going to use that for our search. Click that, and then go down to the bottom right-hand corner and click Search. And this brings up the ZCTA profile. You can click here to view the profile. Just load here for a second. A little slow right now. Here we go. It's got amazing visuals. They just take a little bit longer to load. You'll see that we've got all of this information down here. Got some statistics and details on it. And we can scroll down further for the different maps that are connected with it. All right, so I have shown you just a couple of different ways to get started with searching, but again, there's a lot more to explore on this site. So let me show you how to do that. If you go to Help and then go up here to Explore Data, you can click on their Census Academy. And the Census Academy offers lots of webinars and courses and tutorials on using census data. They also have these short videos called Data Gems, and they provide bite-sized instruction on different things. And this is where you can find out more about zip code tabulation areas, for instance. You can learn about downloading tables or adding extra populations to your tables. So lots to check out there. For right now, we're going to move on to our second resource, and that is County Health Rankings and Roadmaps. And this is a collaboration between the Robert Wood Johnson Foundation and the University of Wisconsin Population Health Institute. Their annual rankings provide a snapshot of a community's health, and they pull together data from several sources, including Burfus. And we're going to be focused on the statistical information that's available here, but I did want to mention that an equal focus of the resource is to enable people to act on what they learn when they visit this site. So you'll find collections of strategies and evidence-based ideas for how to improve local community health. Bring up this web page. Here we go. So we can start looking at an area by clicking on Explore Health Rankings on the left-hand side and then on Overview. And here that you see we can search for things by state, county, or zip code level. Go ahead and enter Washington. You can see we've got a number of different counties, Washington counties. I'm just going to click on the state for now. Bring it up this way. So we've got two maps that show up. This green map on the left shows health outcomes. And when I click on the little info button, it tells us that this is two measures that they rank by: how long people live and how healthy people feel while alive. And together, these are used to rank how healthy a county currently is compared to another one in the state. On the right, we've got this blue map for rankings in health factors. And if we click on the info button, we see that those ranks are health behaviors, clinical care, social and economic, and physical environment factors. And together, these are used to estimate the future health of each county, and they can be seen as a precursor to these health outcomes. And both maps will rank from 1 to however many number of counties there are in the state. In this case, in Washington, there are 39. San Juan is, oops, didn't mean to click on that, sorry. San Juan is the most healthy county in the state. And I think Ferry, yes, over here is ranked 39th in the state. All right, so for those of you who are just following along on your own device, you can go ahead and enter a county that you'd like to look at. Why don't we have somebody type that into the chat box too for what they'd like me to bring up? We'll put that in there. Waukesha, okay. Husband from Wisconsin, so I know how to spell Waukesha. Okay, here we go. So here we see how the county ranks in the state according to those green health outcomes and blue health factors that we just looked at. Scrolling down, we have the option to dig into some of these measures with some more detail. And you'll notice that some of these statistics have a little graph icon here under the trend column. If it's red, that means that over time the measure has been getting worse. If it's yellow, it means it's been holding at the same rate. And if it's green, it means it's been getting better. So just pop on one of these, and this brings up a graph to show us how the county compares on both a statewide map and with the country. Close that out. We'll look at this measure, premature death. And on the left, we're given some summary information. It also includes the top US performers, so we can see how our county compares nationally. Looking here, we can look at the map that's showing, got a description, which provides a little more detail on the measure and the methodology. Data source tells us where it came from. And then, this one does not have strategies. Usually you would also have something here for strategies, which will share how to take action for improvement. And this icon was yellow, so they could take action for improvement on that one. I'm just going to keep clicking back here until I get to that initial county page that we had. Here we go. So I just want to show you how to compare counties. Find this in the tab up at the top. And you could type in any county that you wanted to. It's also kind of interesting to look at these suggested peer counties to compare with others that have similar demographics, social, and economic indicators. So I'm just going to select from the list. See if there's another one from Wisconsin. Yeah, here we go. Click that. And then we have those measures again, and we have the two counties side by side so you can directly see how they compare. And then you have the ability to add additional counties if you want to add some more to that list. Okay, moving right along to our third resource, and that is City Health Dashboard. This is from the Department of Population Health and School of Public Service at New York University and the National Resource Network. It focuses on health in US cities, which is important because more than 80% of our population lives in urban areas. The dashboard began gathering data for the 500 largest cities in the country, but in 2020, they expanded to include small and mid-sized cities with populations over 50,000. So it currently provides data for 906 cities. And the 36 indicators that they measure are pretty similar to those that are used in county health rankings and roadmaps. They focus on health, the factors that shape health, and the drivers of health equity. Some of these indicators can be narrowed down to the zip code or census tract level too, and others are just available at the city level. I'm going to click on the link here now to bring up this page, pull it over. All right, so if you're like me and you don't know if the population of a city you're interested in is over 50,000 just off the top of your head, you can start typing in name of a state, and automatically those cities that are large enough will populate below. So those that are following along on your own device, you can type in a city or a state that you'd like to look at, and I'll take that in the chat box. Who would like to look at a city, or you can name a state too if you're not sure, if something is large enough. Peoria. All right, let's do that. Oh, Peoria, Arizona too. All right. It's always interesting to look at these cities. So we've got our city up here. Now it's time for us to have select our metric that we want to look at. Would anybody like to look at one in particular? What looks good? Uninsured. Where do we have that? You might have to tell me where it is on here. Here we go. Yeah, got it. All right, here's our metric. Uninsured for 2020. And we can learn more about the metric here with this little drop down. This will give us a definition, tells us more about the source and the year of the data collection and the data availability level, tips and cautions for using this information. And then here we see that we can also download this so we can do our own additional analysis. Go back up to our result for uninsured. And information will be presented through these shaded bars like this. And they use a yellow marker to show where the city falls on the score and a little triangle to show the average for the cities that are in the dashboard. And every indicator is a little different. Sometimes being higher than the average is better and sometimes being lower. And the dashboard tells you lower values indicate better outcomes. And there'll be this little green check if this particular city is better than the dashboard average, which Peoria is. We can scroll down here. We see a city map. And here's one where we've got that information available on different census tract levels and zip code levels. Again, not every city will have this level of detail, but here we do. And some of these metrics will have demographic detail to share. We can click on that up here and we'll see if it's included for this one. And we do. We have uninsured by race in Peoria, and we can look at Asian, Black, Hispanic, white, and then also by gender. If you're following along, you may have chosen a metric that doesn't include this, and you can click over and change your metric to uninsured if you'd like to look at that for your city. And then similar to county health rankings and roadmaps, you can do a comparison, side-by-side comparison, select another city. Just gonna load for a minute here. And we can just enter our own. Let's see, let's find another one in Illinois. And then we just scroll down and we'll see that we've got this for both Peoria and Orland Park right here. So what if you'd like some information on a city that is not one of the 906 largest in the country? Well, in that instance, then this fourth resource, Rural Data Explorer, might be helpful. This is part of the Rural Health Information Hub, which is funded by the Federal Office of Rural Health Policy, and it's a national clearinghouse on rural health issues. Fantastic resource with lots of information. They have a data section on there that contains health statistics of interest to those living or working in rural areas. And we're not going to demo this site, but just know that it's really easy to search. From the homepage, you can access statistics by going up to Rural Data Visualizations here at the top, and then going into Rural Data Explorer. And it's going to default to a county metropolitan classifications map. And you can see the source of this map right down here is NCHS. You can also see that it's a little dated when we made this slide. You can change the select data year too. And then you can use the drop downs that are at the top of the screen to look at different metrics that are of interest to rural areas, like health disparities, healthcare access, and as we have shown in this slide, health workforce. And you can also click on the map to narrow down to county level statistics. And you can compare metropolitan counties to non-metropolitan counties. All right. So based on previous evaluations of this class, that when we've conducted them nationally, we have expanded today's session to include information on international statistics. And you're our beta testers for this new content. And you're getting it before anyone else. I'm going to be teaching health statistics on the web next week as part of a national NNLM course offering, but it's going to be our original hour-long class. It's not going to be expanded with the in-class exercises or have this international statistical content. So let us know what you think about this when you complete that evaluation. And we may start offering this next year. So with that, we just have one international resource to explore, and it's a biggie. It's the Global Health Observatory. And the Global Health Observatory is produced by the World Health Organization, or WHO. WHO is the United Nations agency addressing health, and they direct and coordinate responses to global health emergencies and lead and champion worldwide health equity efforts. The observatory serves as WHO's gateway to health-related statistics. It collects and analyzes health data on the 194 UN member states to provide easy access to statistics and to monitor global, regional, and country health situation and trends. It also provides direct access to data sets. And though the observatory was established in 2009, it does include historical WHO data, and some of that goes back to 1950. The observatory currently tracks over 1,000 indicators, and they're grouped into 31 key health themes. And the themes include mortality and burden of disease, non-communicable and infectious disease, health systems, environmental health, and health equity. And the methodologies used for the indicators aim for comparability across countries and time. So for that reason, a statistic that you see on Global Health Observatory might not always match one that you'd find on a country's official national estimate. Excuse me. So here's an instance of what I mentioned at the beginning of class, that statistics are collected to meet the needs of the collector, and estimates of the same statistic might vary due to the use of different methodologies. Okay, we're going to bring up this page now. And here you see, we're just going to start getting oriented to the site, and you see at the top a couple of different ways to start searching for WHO health data by indicator and by country. And beneath that are boxes highlighting 3 of the UN's Sustainable Development Goals. And these are referred to SDGs, and you'll see this acronym a lot on the site. The SDGs are 17 broad goals that all of the member states agreed to achieve by 2030. And one of the SDGs is specifically dedicated to health, but nearly all of the remaining SDGs indirectly contribute to health. So within those 17 SDGs, there are 169 specific targets. And the targets highlighted here are universal health coverage, health emergencies, and health and well-being. So underneath this, we have an area for COVID-19 data, including an interactive dashboard for the latest global numbers, and there's a collection of current and archival situation reports. Below, we have an area where you can search by theme, and these themes cover WHO's major programs and areas of interest. And you can either enter a few keywords in the search box, or you can browse the theme icons. Further down the page, we have an area for data portals, data sets, and dashboards. Okay, I'm going to scroll back up to the top of the web page now, and we're going to start taking a closer look at each of these areas. So I need to say that the indicator search function is pretty clunky. I tried in vain to find some tutorials or other user guides online, and I also reached out to WHO library staff for some guidance. I did hear from one data manager in Switzerland who shared with me that they're working to make this searching by indicator better. and that they hope to have improvements in place later this year. So here we see that we've got these indicators showing below. The indicators, as most of the data that's included in the observatory, is organized to monitor progress towards the SDGs. So you'll see those down here in this list. This is a select group right here that's available to click on. And then we can also bring up the full list of indicators down here below. So let's say I am interested in understanding air pollution in different areas of the world. I've got this on the select list here, so I can click on that. And I have a couple of different options to explore. I'm also going to enter air pollution up here into the box, and I'll show you how this information looks a little different. A much more detailed list. And I can explore statistics in terms of disability adjusted life years, or by what's down here, years of life lost, household, ambient, all sorts of different things I could try. I'm going to click under World Health Statistics and bring up indicator 3.9.1, mortality rate attributed to household and ambient air pollution per 100,000 population, age standardized. That age standardization is an adjustment technique that allows statistical populations to be compared when the age profiles differ. So every indicator page will have these 4 tabs across the top. We've got the visualizations tab showing now. And oops, loading again. Visuals are so good, they take a while to load. I click on here for a minute and then try going back in, because the map did populate right away when we first brought it up. Here we go. Let's see if I can scroll down here. Okay, so we have an interactive map here. I could hover over different countries and I'll see the rates for attributable death from 2016 around the world. The lighter colors indicate lower numbers and the darker indicate higher numbers. So let's say I wanted to dig deeper into what's happening here in Sierra Leone, which had the highest rate globally in 2016. I can scroll back up here and click on the data tab. And here you'll see the data presented alphabetically by country. Countries are in the far left-hand column. You also see that it would take a little while to scroll down to the S's to get to Sierra Leone. So I can click on filters and then go down here to country, find Sierra Leone, hit apply, and here we have that information. And I can go to the metadata icon and read a full description about this indicator, information about why it's important to track it, and the methods that were used for this statistical analysis. And then on the related indicators tab, I'll find some additional quick links to content. I'm going to go back home and I'm going to show you yet another way that I could bring up some air pollution information by going down here to themes. And I could type that in here if I didn't happen to see right off the bat that we've got a little icon here for air pollution. Clicking on that brings me to the air pollution data portal. And these data portals are awesome. They have an overview of who monitors in this area, very complete. I have access to quick stats and various data. They've got interactive tools and resources, And then at the bottom, they have relevant WHO publications and progress reports. So it's just like one-stop shopping for me here. Okay, let's go back to the home page. And I will show you the country search. It's not exactly what you'd think. It's not an option to search for a topic by country rather than indicator. This is just a way to access select national data for a country. Let's stick with Sierra Leone here for a moment, and we'll bring that up and I'll show you what kind of information you have. We have stats on about a dozen indicators in the area of mortality, immunization, sanitation, and health spending. And these indicators aren't the same across all the countries. And as you can see, there's no air pollution here. So it is very select information, but it can at least give you a little snapshot on a country. All right, let's go back to the home page and go down towards the featured portals. And we looked at that air pollution data portal a moment ago. And I'm just going to say in passing, this global observatory on health R&D is a pretty unique source of information. You find statistics on research and development worldwide, and you can track what's happening where and identify where there are gaps and where new investment might be needed. And I think it's the only place where I found information like that. It's pretty interesting. We'll go down here, and the last thing I'll show you on this site is one of the featured data sets. It's the mortality database. Bring this up. This is a collection of death registration data with cause of death information from UN member states, and it's become a premier data source for international comparative epidemiological studies of mortality by cause. It currently contains data from over 120 countries, so not the full number of UN member states, but they do have some data which goes back to 1950. And this cool interactive portal that you see here was launched in 2022 to showcase the data set. So I'm going to scroll down a little. Nope, I'm going to stay right here. I'm going to click on this to bring up countries. And I'm going to click on Australia because I do want to pick a country that has some of the older data just to show that to you. So here we've got the overview profile showing, and we can scroll down. And we can see this data is from 2020, and the non-communicable diseases make up the largest category for death in Australia. And then within that, we see that cancer is the largest group there. We can go down to the additional information to see how this stuff is all broken down. We'll see what those cancers look like here, this colored graph. So let's change this. Let's see how different things were in 1950. We can go here to year. I'm going to scroll down, click on 1950, and hit apply. And then we'll see still non-communicable diseases, but cardiovascular disease was the leading cause of death back then. Let's break this information down just a little bit more. We're going to look at cause of death evolution profile. And here I'm going to look at female. Oops. Select 2020. Hit apply. And then you'll see that cancer wasn't the top for female in 2020. It was Alzheimer's and other dementias. Let's see how this breaks down for different age groups. You can go down here again. Select 2020. Female. Hit apply. Here we have that first overall view of cause of death, but then we can look at the different age groups down below and see how very different everything is. And we see that with the age group 35 to 54 and with 55 to 74, we do have cancers as the top causes. And then down again, we have Alzheimer and other dementias. Pretty interesting to break everything down and dive in further. All right. Let's have another quick question break. See if there are any questions on any of the 4 local resources or the international resources that we covered. Glad you like the owl. Thank you. I think that's the Midwest mascot too, right? The MLA Midwest chapter. All right, no questions right now. We're going to be moving into the guided handout part 2 of our exercise. So if you have questions at any time, I'm gonna just remain here while you're working on them, and you can ask questions either through the chat box or just unmute and ask me directly. We're going to go back and work on steps 2 through 4 of the 4-step process for locating health statistics. So, and all those steps are up there on the slide. They're also on your handout. Step 2 is to choose the best resource to answer your question. And you think about who might collect the data to produce or publish the statistic you're interested in. That online table that we included with your class materials can also refresh your memory on things, but do remember that we don't have Global Health Observatory on there yet. I apologize for that. Then step 3 is to conduct your search and evaluate what you found and see if it's appropriate and sufficient to answer your particular question. Step 4 is then to repeat as needed, searching in another resource for appropriate and sufficient information. So we have enough time here. Let's take about 15 minutes and you can start digging around in these resources and exploring yourself. And again, I'm going to stay on here and I can answer questions that come up while you're searching. So don't be afraid to ask for anything and just enjoy getting to dig into those. For those of you that don't have a laptop handy, I think you can get to all these resources on a phone too. It might be a little more challenging, but still do it that way. The other option is if you don't have anything available, you could just start making some notes on here about what resources you think might have some answers for your question. All right, so we're going to come back here just about, a little after 2:30. Let's say 2:35. We'll do that. So we're going to start coming back in just a couple of minutes. So if you're in the middle of a search, you can wrap it up and we will regroup in about 2 minutes. All right. I welcome everybody to unmute themselves and turn on the cameras. I would love to hear what questions you came up with and how your searching went, if you were able to find any statistics on those resources. I can't quite see hands raised. I can't see that. So just pipe right in.
Can everyone hear me? Okay, my name's Samantha, and my question ended up being, in the state of Illinois, how did the number of adult African American diabetics change over the last 5 years? So I searched a few different places. And I was able to find some information in a few places. I was able to find a few statistics within the National Center for Health Statistics underneath the National Diabetics Statistics Report. But that was only able to give me numbers for crude numbers for 2019. Then I went to Breakfast, the BRFSS, and there I am able to see up to 2020, and there I can actually have it separated by ethnicity. And so I saw that while the numbers have been going down, ironically, the percentage has been going up, but that's probably more due to population loss in Illinois. Yeah, that was my searching.
Yeah, and I think with more recent statistics, there'll always be a COVID-19 caveat built into a lot of things too. It'd be interesting to see how methodologies and information on those statistics is noted later on. And, I think Burfus also has, we can bring up things by location and topic, and I think they have another category that's for chronic disease, and you can find diabetes in that section too. That's a
That was
great
actually
question.
where I found it in the chronic health indicators.
Great. Yeah. Glad you found that one in there. We didn't highlight it.
So I can go. My name's Holly Hudson, and I wanted to basically compare and see how the infant mortality rate compared from Illinois and compare that to the United States, and then compare that to like a broader country, like another country. So I ended up using the state health facts, which kind of helped me narrow in on Illinois specifically. I also used some of uh, the National Vital Statistics reports, and I think I found that in, what's it, preface, I think. It might have been the National Center for Health Statistics. I think it's actually where I found that. And so then between the two of those, I could kind of see what Illinois statistics were, and then I could compare that to the US when I went over to the WHO mortality base database, and I compared the US statistics so that I could kind of see, like, comparatively where Illinois is compared to the US. And then I used, like, I looked at the US and then I looked at Germany, but I wanted to kind of see. So
Interesting.
yes.
How were the numbers?
Not great.
Yeah.
So compared to Germany, the US was not quite double, but then Illinois is worse than the US overall. So not by a lot.
Interesting.
They're pretty average, but like Illinois is like just a little bit over the US national average for infant mortality, and then the US as a whole has significantly higher infant mortality rates than Germany. So
Interesting. Did you have any time to look at how the statistics in each of those different resources was calculated? What
oh,
methodologies they used?
I
Did those
didn't
seem fairly consistent?
I didn't look a ton at the actual methodology. I tried to do it most of the time by percentages to take
Mhm.
out a little bit of some of that, but I didn't look to see like what they were actually, like, how they'd measured it or how they actually figured it out. And I don't know I don't know what type of COVID anything, because I tried to search like 2020 and 2019 to give me pretty close.
Mhm.
But I didn't look to see the actual methodology, how it differed or what they were measuring exactly.
Well, it seems a little weird to say how fun for a topic like that, but it's neat to dig into all those resources and see how they vary amongst them.
Yeah,
Great search. Yeah.
thank you.
And I see Samantha, you answered Evelyn's question in the chat. Thank you for doing that. Yep, that was perfect. Would anybody else like to share their question and or their experience that they had? I'm also curious about which of these resources were new to you. Do you have if they're not new to you, do you have a favorite that you regularly turn to answer questions that you receive?
Well, I had not used the Burfus before, or the Kaiser State Health Facts. I had just been using county health rankings recently for a couple of questions I'd had. And so it was cool to see that again. And I haven't used the city health dashboard before. So those were definitely some new things, or just new ways of looking at things that I hadn't seen, that are going to go on my list now for future questions.
Great. Data by profession, specifically RNs. Meg, that's a good question. So are you interested in like numbers of nurses now, that type of a thing?
Can you hear me? I'm not sure if my mic is.
Yes, I can hear you,
Oh,
Meg.
good. Thank you. Yeah, so thinking of a question that came in last year, I work with educating nurses, and the prevalence of vaccination, COVID vaccination and boosters for RNs is a question that came up, a lot recently. So that was what I was using as my example, and I didn't have any luck.
Yeah, I want to say that state health facts, Kaiser collects information on workforce. That Rural Health Explorer, which I didn't do a live demo, was that also collects information on workforce, but again, it might have um, cover a different geographic area than you're interested in. I'm trying to think of other resources. I think I've seen in the chat a few people have suggested national associations and organizations for looking at those kind of numbers. That's a good question. I'm going to see if I can find some more information on that. Great. Any other comments before I bring up that PowerPoint deck again? See that we've got a few resources that are new for all of you. Yeah, and it seems I'm not alone. That Global Health resource, Global Health Observatory is a new resource for many. And I'm eager to see if that person in Switzerland is right. They're going to be improving the search function on that. We'll see. All right, so let me go back here. I've advanced the PowerPoint slide. Can everybody see that okay? Great. Okay. So if you have gotten really interested in playing around with data directly after taking this class, the NNLM National Center for Data Services has a workshop coming up in just a couple of weeks. It's on September 22nd, and it's called Analyzing Health on the Local Level, Accessing State and Regional Substance Use Data. And that class is going to be focused on finding and requesting local and regional health department data sources. In a previous version of this particular class, we did include a brief mention of looking at state and city health departments for data and statistical information. They're a great resource to use. So in this particular hands-on class, you will be learning how to access and combine online data sources. You're going to get practice in critically appraising data sources as well as data collection and compilation methods. So you'll be able to look and see, was that methodology valid? How does it rank and compare with other resources and methodologies? And you'll be able to explore descriptive data trends. And you'll find the registration page for that class on the nnlm.gov website in our class calendar. All right, so that is a wrap on the class. We've reached the end of everything. If you have any questions in the future, you can definitely reach out to me. I put my contact information on the slide, and you can also just go to the NNLM website and look me up there too. We do have MLA evaluation instructions. I copied them into a Word document. I'll bring those up in just a second. It's got the link for completing the evaluation to obtain your CE, and we have the enrollment code. It's also showing there on the slide. It is not the evaluation link, it's the enrollment code. So I definitely appreciate the feedback on the course, and I thank you for coming. So let me get this other document showing here now too, so you can just see this if you need a refresher on how to get that MLA CE. Is that large enough for everybody to see?
Yeah, that looks pretty good. Erica, this has been wonderful. Thank you so much.
You're welcome.
Yeah.
We've wrapped up a little sooner, so there's your 10-minute break added on to the break that'll be in the conference. But let's see if there's any other questions here last minute. Yeah, the cat squalling. That's good.
Yes.
All right. Great. Well, I'll just leave this showing up here, and I'll just stick around for the next few minutes if anybody does have any final questions. But thanks everybody for attending, and hope you have fun with those resources in the future.
Thank you.
See ya.